This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Claire Saldran, filling in for Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Your children spend more time in school than anywhere else aside from your house. By mingling with many other people, your children are exposed to bacteria and viruses that may lead to some back-to-school ailments.
Ang common diseases na nakukuha ngayon ng mga bata sa school, lalo't ngayong pasukan, ay itmang sumusunod. Halimbawa, yung ubod-sipon, may iba pang sakit, mga trangkaso natin yan. Tapos pwede rin magkaroon ng sore eyes.
Parents are encouraged to monitor their child's health by looking for signs and symptoms of any of these illnesses and how they progress over time.
Mainam din na maibigyan natin ng flu vaccines yung ating mga bata. Lalo sa panahon ngayon, papasok na ng tag-ulan, madaling makahawa yung mga trangkaso na yan. So mainam din halimbawa maibigay sa kanila yan.
Promoting healthy habits like eating a balanced diet and exercising regularly at a young age is recommended.
Kumain ng masusustansyang pagkain, yung isda, yung gulay, yung prutas, uminom din ng maraming tubig. Tapos yung pagkain na mayaman din siyempre sa vitamin C. Kung wala naman yun, pwede tayong mag-take halimbawa ng supplement like yung mga vitamin C na syrup natin ngayon.
How can children cope with the rainy season? What can parents do to help their kids remain healthy? All these and more tonight on MedTalk.
Joining us tonight is Dr. Maria Lourdes Lagunilla, a fellow of the Philippine Pediatric Society, an international member of the American Academy of Pediatrics, and she is also the medical director of the Angeles University Foundation Medical Center. And you may join the discussion by calling our hotline at 548-4678. Good evening and welcome to MedTalk, Doctora.
Good evening, Claire. Good evening, Philippines.
Good evening. Do you know that everyone is back to school by now?
Oh, yes.
Kids are back, and you know, as we know, when kids are all at school, it's possible that they can get sick more often. So how do kids get sick more often now that it's back to school time?
We know that children have very low immune system, and then at the same time, it's the rainy season again.
Right.
So they easily get sick, especially when they mingle with other children again. Just very recently, I'm seeing already children sick on the first day of classes.
That fast?
Yes.
Well, it also started raining.
Yes. Sometimes it rains and sometimes it's very, very hot. And
Yes.
this contributes to the sickness.
Right, right. And so what do you think are the most common illnesses that we see amongst our children, especially now that it's school time?
Oh, they will have all sorts of respiratory infections. They will have diarrhea. And worse will be the more infectious diseases like measles. If you remember, 2 months ago, we just had the outbreak for measles. So we started again the vaccination for measles, the second doses. In private hospitals and clinics, we do them really routinely.
Okay, measles. What about the most common that kids always have? The common cold and cough.
Oh yeah, the common colds is actually the viral infection. Yes, it's also very, very common. But sometimes it can also be like allergic components.
Oh, okay.
Yeah, so they have to keep away from pollution, from so much dust. That's what really causes these infections also.
Okay, and another alarming symptom that we can find from some of our kids is diarrhea, and sometimes it could be caused by stomach flu or stomach bug or a virus. So what should parents watch out for when something like that happens and they start to vomit?
Well, actually, still number one is prevention. We should teach our children to hand wash all the time, most of the time just before they eat, and that they have to have clean water. Of course, the vaccines can also help. Like the vaccination for children, as early as 1.5 months old, they have the rotavirus vaccine,
Right.
because rotavirus is the #1 cause of diarrhea.
So they should keep a check on the list. There's a list of vaccines
Yes.
that they need to follow. What about right before school starts? Is there a particular vaccine that they should take?
Oh, they can have the flu vaccine. This will prevent the different strains of viruses. They
Okay,
can have it yearly. This is given once a year.
once a year. So
Yes.
every year it's recommended that they get a vaccine.
Yes, because there are different strains for every year.
Okay, and not only for the flu, but also the measles and chicken pox.
Yes, chicken pox, wow, it's a dreadful disease.
Right.
Because the children have to be absent in school so that the other children will not get transmitted with the infections. So it's good to have the vaccine as early as 1 year old and then repeat the doses.
Okay. Now, what about, let's say, for parents out there that, you know, we do know, because I'm a parent, and I know that when a child gets a fever, some parents get very alarmed. So when is the time that they should really take their child to the doctor, or when is the time that maybe they should maybe wait it out? Because I think fever is a sign that it's your child is going through an infection.
Yes, that's true. When your child is actually looking very sick, not able to take fluids, not eating, then you have to consult already. Of course, you have the paracetamol, which we usually give, and even the water. But it's not enough. We have to check if there is a viral infection, especially dengue fever.
Right,
Yes.
right. Yeah. How do you know that if it could possibly be dengue?
Oh, the fever will persist. It persists more than 2 to 7 days. And the child will just be very sick also. But sometimes during the first stages, the child will just have fever, that's all. Then you have to go to the doctor to check. We do the tourniquet test, we do it repeatedly, and sometimes the blood count will help us.
And is dengue very common now that it's back to school time?
Yes, it will be, because it's the rainy season again. It's the breeding time of the mosquitoes. They're the carriers of the disease.
And how can the children prevent, or how can the parents help their children prevent getting dengue from school?
Wow, it's a community effort also. You have to have a very clean environment, free from mosquitoes, and even, of course, the school. It has to all be clean. If you can screen the rooms, it's better.
Right. Would you recommend the, kids' lotion or the patch that would
They should
scare
be good,
away
but
the
there are no
mosquitoes?
real studies that tells us that it's 100%. At least it will help. But preventing is really very, very important, like maybe wearing longer dresses or pants.
Right.
Yes.
Right. That would be a safe way. When is the time that it really peaks, the dengue season?
Well, about July and August until the months of October, we have a lot of cases.
Okay, so be very careful out there, especially these months, and make sure that you have some extra clothes for your kids, long sleeves. And
Yes, that's true.
Yes.
But you know that dengue is already all year round. It only peaks during this season when the rain comes again.
And unfortunately, there's no vaccine yet.
No,
for
not
dengue.
yet. Maybe next year, hopefully, because it hasn't been perfected yet. Not yet.
Okay, let's talk about the other diseases that's possible that the kids can contract. Urinary tract infection. What are the symptoms of that? Because sometimes a child will not really display any symptoms.
Fever again.
Okay.
Fever and even vomiting.
Okay.
They are very non-specific. Although occasionally some children can complain already of pain. But it's always fever. And how to prevent it is still like hygiene, personal hygiene. Because many children, as young as, of course, the kindergarten, maybe because they have to go to school, they still wear the diapers.
Right.
And of course, they should be toilet trained already
Okay.
by this time.
Okay, okay. Oh, and we have a Facebook question right now, Doctora. And the question is, what is an effective way to combat head lice? And that's very common also in the Philippines.
Again, it's personal hygiene, and somebody should not transmit the infection to you. Because if there is somebody who's infected, you have to treat the whole family, everybody, so that you can control the infection.
Okay, and is it easy for kids to get that amongst themselves in
Very
the classroom?
easy, very easy. The closeness, they get it easily.
Okay, and of course the symptoms would be if she's scratching her head more
Yes,
often than she has something there.
Right.
What would be a good, what would you suggest how to treat head lice?
Well, there's a shampoo. There's a shampoo that you have to use, which you will have to apply overnight, and then do the shampoo again the following day.
Okay.
And very surely they will be treated. But everybody in the family should be treated also.
Okay, because it can easily
Transmitted.
transfer to one person to another, especially at home.
Yes, yes.
Okay. What do you think are the other ailments that are uso, like in the back-to-school months?
Oh, well, sometimes they also have the school problems, like they just vomit for no reason. They come to you, they've been vomiting several times in the early morning. And then you'll just find out maybe it's school phobia again.
Ah, school phobia.
Yes, they will have their own stress. Their little stress will come during school time. Sometimes even just severe headache for no reason.
Right.
Then comes the weekend, they're very well.
Ah, so how would you diagnose something like that?
You get it from the history.
Okay.
It just happened now. The parents will tell you they were good all the time during the vacation time. And now come school, they'll just start vomiting again.
Okay.
Then you just have to reassure them.
Okay.
And maybe talk to the parents and even to the teachers to make them feel good. You know, school has to be fun. It doesn't have to be very stressful. They should be happy in school because they'll be spending about 4 hours, 6 hours of their time, daytime.
Yes, that's true. That's true. It's something really to consider. Now, another question is, what are the red flags that we should look out for with our children so we know that, this is something of concern that's very serious that we need to pay attention to?
Oh, the child is not doing well. He's not interested going to school. He always sleeps most of the time. Sometimes we should not also forget that they may have also visual problems like error of refractions. So they will always have headaches in the morning. So you have to see your ENT for that or your ophthalmologist also. They may also have problems in hearing. So you have to screen them also to have those ears cleaned so they can't hear well. They're not very attentive to school. Then you have to check this. Of course, fever is always a manifestation of infection, and the diarrhea, it's another thing that parents should look into.
So how do we prepare our children before school starts? Or maybe now that the school has started, we can still sort of encourage them. How would you advise parents to encourage our children?
Number one, you have to make them physically healthy.
Okay.
Your nutrition should be good.
Okay.
They have to have good sleep, 8 hours sleep.
Okay,
So that the following day, they're just so awake.
True.
They're not very sleepy in school.
Yes.
Emotionally, you make them feel good that the person right there is just the second mom. It's a second home. You should be happy also. And of course, intellectually, then you go by like being the second teacher also at home. You just look at their things that they have to study and tutor them by yourselves, and you know very well what's wrong, what they do not understand. You can just tutor them rather than anybody else. It's still the mom or the dad who knows best.
Right, and it builds their confidence level.
Yes, that's very important. They should be very confident coming back to school every day.
That's number one. Well, we'll talk more about tonight's topic when MedTalk returns.
Did you know that children who are born to educated mothers are less likely to be stunted or malnourished? In fact, each additional year of maternal education also reduces the child mortality rate by 2%.
We are back on MedTalk, still talking about health issues among school children. Doctora, now let's talk about the importance of regular doctor visits or checkups to the doctor. How important is it for parents to bring their kids to the doctor?
It is very important because it is at this time that you will see the growth and development of the child. If the child is growing well or if the child is already obese, especially the lifestyle now.
That's true.
Yes.
There is some talk about, what you're feeding your children. So, which brings us to a question that, for baon tips, what would you recommend for parents to pack for their lunches and recess baons for the kids?
Basically, Filipinos are rice eater, right? But it's very difficult to prepare that in the morning. Maybe we can go ahead with cereals together with milk. Even hard-boiled eggs should be good, bread and cookies, and even some fruits if you can introduce them.
Right, right. So, of course, definitely no junk food.
Of course.
Stay away from
no
the
soft
junk food.
drinks.
No soft drinks, yes, because those can lead to being obese.
Yes.
Correct. And also, like with my kids, how can I encourage them to eat more vegetables? Because not a lot of kids, it's really hard, difficult to feed them vegetables. But it's important that they have some vegetables in their body because it brings some vitamins to their body that it's probably lacking.
There are some easy vegetables to eat, like carrots. You can take it even as it is, raw, right? So you can even take your potatoes. Your vegetable should be half cooked. It should not be so cooked because you lose the vitamins anyway. Yeah, but not many take the vegetables. So usually we have to use the vitamins this time.
Okay, vitamins, the one we were talking about
Yes,
earlier.
the multivitamins.
Take multivitamins. So it's really recommendable
Yes.
that they have their daily dose of
Yes.
vitamins. We have a Facebook question, Doctora, and this person is asking, my kids only like eating chicken and hot dog. So how can I encourage them to eat healthy?
Well, actually, it's the parents who introduce the bad foods. So it's actually who also asked to withdraw those bad foods because we have to eat together.
Right.
Chicken is just good, but it has to be cooked at home, not the processed chicken, not the processed hot dogs. So it should be like we can cook them with good cooking oil, fresh, fried will do.
Okay.
Even your tinola should be good also.
Right.
Anyway, it's a good source of protein, but not the processed foods as much as possible.
Yes.
Because they're salty.
Yes, like the hot dogs, not as much.
Not as
or
much.
canned goods.
Yeah, I'm sorry, yeah.
When kids like that, pa naman.
Because we introduce them and they like it. It's very tasty because of the salt content.
Okay.
But the more salt that you get, the more fluid that you get in the body, you become edematous, even obese. So we try to shy away from them.
Yes, and the salt content can be known from the sodium content that you see in the canned goods
Yes.
or the packets of
Right.
like maybe instant noodles.
No,
Diba?
it's a no.
Yes.
It's called instant because you just need to eat now. But it should not be an everyday thing.
Make it fresh,
Yes, you have to cook the food.
Make the fresh noodles. Noodle
Right.
soup, chicken
Yes.
noodle soup.
Yes, that's good. Still the old noodle soup.
Right. And we have a Twitter question now. How effective are flu shots that are given to children?
They are very effective. When children get the flu shots, they seldom get sick. And when they get sick, it's very mild. They recover very, very fast.
Okay. And where can they get the flu shots? Because aren't there centers that provide this for free?
Oh, the centers would not provide this yet. It will still be their pediatricians.
Okay.
Well, they can talk to the pediatricians. They can get it at low cost anyway.
Okay.
It's very much available and they need it.
Okay. And same goes with measles shot and chicken pox. All those shots have
The
to
measles vaccine, they can get it from the center. If they'd like the second dose, they can get it from there. But for the private, they have the MMR,
Yes.
which is the measles together with the mumps, the German measles. And then we have also the chickenpox vaccine, pneumococcal and meningococcal vaccine.
Yes.
This is for meningococcemia. We hear a lot of diseases like meningococcemia outbreaks, and the only way to prevent it is get the vaccine also.
Okay, I remember all those because my kids have a list of vaccines and there's a check mark and the date of when they took all the vaccines. And it's 100% effective, Doctora?
I would say so. If you get sick, it will be very, very mild. Almost that you cannot really identify that you became very ill.
Right. So the safer the better.
Yes.
But the MMR, I know because it's 3 shots in one. So it could have an adverse effect on the child, possibly some side effects when a kid gets a vaccine?
Not necessarily. Every vaccine, after a vaccine, you may or may not have fever. When you get fever, you just get the paracetamol, and it's very, very mild. Rather than get the illness itself, get the vaccine because it makes things milder.
Okay. Now let's go back to, let's talk about the importance of parents in the school performance of a child. Since it's back to school, what do parents need to do to prepare their kids when they go back to school?
Yes, I said so. Like prepare them physically with good nutrition, and then encourage them. Everything that they do, like you have to praise it. Whatever it was, their grade was not so good. You said you can make it better, but this one is already good. I know you're gonna make it. If we like review again, we'll do this over and over and again, and the next time you'll do it, I know you'll make it 100%.
Okay. And what if a child has trouble? Let's say, you know, you're a 100% parent, you're a cheerleader, you're encouraging them, but, you know, there's still some, you sense that the child is still having some trouble. What's the next step from there?
I think you have to go to the doctor really, just to check there's really nothing wrong. There are some children, like even my own child Dan, he always have headache in the morning. Then lo and behold, he had this error of refraction, so he had to wear the glasses at grade 1.
Oh.
And after that, he was perfectly well.
Okay.
Yes, even the ears. Many of my patients lose interest in studying because they can't hear. And it's just the cerumen that's blocking the ear. When we consult the ENT, they're perfectly well again.
Okay.
And they regain their interest again.
Okay. And what about allergies? I know some children out there, you know, poor kids, they have allergies. They can't eat certain food. What would you advise to the parents? Because some of them might be nervous to send their kids to school because the kid might eat something that they're allergic to. So what would you advise the parents to do?
The food that are more allergenic actually are the chocolates. Unfortunately, children love chocolates, nuts, seafoods, which they do not take so much anyway. The egg white. The egg yolk is okay.
Okay.
Yes.
So try to avoid those things first. And if they do have allergies, is there a way that you can maybe inform the school or the teachers?
Yes. Usually they ask for medical certificates just before school. Then we can write some problems that they usually encounter, that they have to get ready with some medicines to counteract the allergy. And then they also have our contact numbers that they can call us just in case there are problems also. And now they already have their school physicians, right?
Yes. Yeah, so just in case.
Yes, just
or
in
for
case.
emergency.
Yes.
Now, also, my kids, or I think other kids I noticed also, I know that they need their protein. And most of their protein is you can get from meats.
Yes.
And sometimes the kids, they don't like the texture of meat, or they have a hard time eating it. So what would be maybe other options to fill in their protein needs?
Well, you have the ground beef in spaghettis, in pasta. It's easier to eat then. You can slice it, but you know, it's only how you prepare the food. And I think they can get much from the protein, even from the chicken. The fish is very difficult because, you know, we have the fish bone. And it's very hard to remove the fish bone. So we get away from the fish bone for the meantime. The fish, we give them more of the chicken. Pork will do.
Yes.
Then you have your hamburger, but of course, it's not always the hamburger that you have to give because it's, again, salty.
Okay. So just make sure that you put just the right amount of salt. Okay. Any other tips and advices to all the parents out there with their kids who are going back to school at this season?
The advice is, let's get our children ready. We love our children, and we will introduce the teacher as the second mother, their second home, because they will be away from home. Assure them that you're just around. And when they come home, you'll be ready to receive them again and encourage them. Give them, again, enough sleep and food so they prepare for another day.
Okay. Well, thank you so much, Doctora, for joining us tonight.
Thank you, Claire. It was a privilege. Thank you.
And we would like to thank Dr. Maria Lourdes Lagunilla for enlightening us with some of the most common health concerns of kids. And when we return, we'll talk to a child psychotherapist, Lilian Nanggi, as she talks about separation anxiety and other issues of children in this back-to-school episode. All these and more when MedTalk returns.
The start of the school year can be an exciting yet nerve-wracking experience for young children. One such concern is separation anxiety disorder.
At a certain age, children would have what we call anxiety of abandonment. They've been always with their perhaps moms or maybe with a consistent caregiver at home, and suddenly the child will be left with other children on his own. No? So they feel that separation anxiety would be present.
Children experiencing this may cry frantically, display shyness, hold on to a parent's hand or leg, and withdraw from their classmates and teachers.
They kind of cling to the parent. Clingy sila. Or they always ask, where are you going? When will you come back?
Single mother Katrina Digico cannot help but have mixed emotions as her 3-year-old daughter Kitten is set to attend school for the very first time.
Before siya mag 2 years old, marunong siya mag-count 1 to 50, and then before siya mag 3 years old, kaya na magsulat ng mga letters. And then tinanong ko siya, Kitten, you want na mag-school? Sabi niya, yes. Tapos the next day, tinanong ko ulit siya, Kitten, gusto mo na mag-school? No.
At the age of 2, Kitty has been able to count up to 50 and write her own name.
Minsan may fear ako na pag pumasok na siya, kung paano siya makikipag-interact with other kids. Kasi ngayon siya lang pinakabata eh. So lahat ng attention nasa kanya, lahat ng gusto niya nakukuha. So hindi ko alam kung paano kapag biglang may nang-agaw ng gamit niya, hindi ko alam kung paano niya i-handle. So yun, nakakatakot sa baka mamaya ngayon gusto niyang pumasok and then tomorrow ayaw na niya. So yun, nire-ready ko yung sarili ko kung paano ko i-handle yung mga ganong situation.
With the proper guidance and patience, separation anxiety can be managed well and should fade as your kid gets older.
There might be some kids who are very good with it, they're okay first day, but we also have the other children. And I think it's just very important that we acknowledge this, okay, and we help them cope with this anxiety.
How can separation anxiety be triggered in children? What can parents do to help their kids cope with the different challenges in school?
And we are back on MedTalk, still talking about health issues among children in school. And with us tonight is Lilian Nanggi, a registered psychologist and a child psychotherapist at Sunflower on the Hill of St. Louis University. And of course, you may join the discussion by calling our hotline at 548-4678. And now, as we know it, when kids are going back to school, unfortunately, there are some children that display some sort of anxiety before school starts. Let's go through it. First, what is separation anxiety?
Actually, separation anxiety is, a feeling na nasa-threaten sila. Diba? Something that is unknown to them and that is something that they fear. It's basically a fear of what's going to happen. So all the children, most of them will really go through that unless parents properly explain to them na, school is not like that. What Dr. just mentioned, prevent it by explaining ahead of time to the children what to expect in school.
Okay, now what are the behavior or symptoms that we see in our child that could display possible anxiety?
Most of them, they don't want to wake up in the morning, go to school. Some of them will vomit. Some of them will cry. Some of them will come up with all sorts of reasons that parents, they think, to convince their parents not to let them go to school anymore. Vomiting, one of them, pretending they have fever, they're sick, is one of them, not wanting to wake up in the morning, not wanting to go to sleep at night. Those are the symptoms of a child who is, having this kind of anxiety.
Okay, is it normal? Does it happen to a lot of kids out there, or is it something that maybe parents should worry about, that there's possibly something really wrong in the family or with their child?
Actually, these things happen to children who have a very close-knit family. They are always with their mom, with their dad, and any adult figure to them, they're scared. So it's better talaga to have children socialize first before actually putting them in a school. This normally happen, of course, because they're young and they're afraid of, they have all this kind of fear, what will happen if mommy's away, daddy's away. This is very normal. In fact, to me, some of this anxiety, these kind of fears are positive because it will motivate the child to excel in school.
So it doesn't mean there's really
Yes.
something wrong. We have a caller on the line right now. Good evening, Lizelle. Your question, please.
Hi, good evening.
Good evening. Your question, please.
My question is separation anxiety the same as a social phobia?
Is separation anxiety the same as a social problem? Yes.
Actually,
Social phobia.
social phobia.
Social phobia.
Social phobia is fear
Phobia.
of being with people. Okay? Separation anxiety can lead to that, but it is not the same because separation anxiety is fear of being separated from your loved ones, from your parents, from your primary caregivers. But if not properly handled, separation anxiety might lead to social phobia.
Okay. Do you have any other questions, Lizelle?
Wala na po. Thank you so much. It really helps.
Okay, thank you. And what, like you mentioned earlier, Doctora, what else could be the possible triggers of separation anxiety of children with their parents or loved ones?
Most of the time we think that the child don't want to go to school. That is what we think, what parents want to think. That's the most comfortable reason. But again, try to look and find out what is the real reason. It might be that there's something happening in the family. Maybe there's a separation. Parents are arguing. Parents are not in good terms. Or parents are not attached to the activities of the children. Many things can happen. It's not about school only, about the bullies, about the teachers, about the subjects that they're afraid of. They can all be reasons for a child not to want to go to school. But again, first look inside the house. What is the reason that this child don't want to go to school? Is it because there's a transition from home to house? Is the school so big that it's threatening, the feeling of a child? Of course, they're so small and they're used to their house. Everything is under their control. They know where their rooms are. But being from a house, separation from a house to going to a school can cause the child also separation anxiety. It's better to look into the reason why before we say it's actually the school.
Okay. And also, what are the effects that it could possibly have on the child that they feel this fear of going to school? Can that possibly affect them, maybe their performance at school or them being able to make friends or relationship with their teacher?
Oh, I was thinking about that when you mentioned it. Of course, the effects would be of course, the first one that will be affected will be the child. If the child have this anxiety of going to school, that means the child will miss school. Either the child will be late, the child will be absent, and if the child is absent or late, the grades will be affected. And if the grades are affected, of course, the child will have low self-esteem. And if they have low self-esteem, all the more, they will not want to go to school. And of course, they will always be bullied. And the sad part is they will be labeled as, not motivated, lazy. But the truth is there is something behind the child that causes the child not to want to go to school.
And how are we able, as parents, how are we able to find out? Because some kids could be as young as 3 years old or 4 years old and can't really express themselves really well yet. So how do we find out, especially for young kids like that, what's wrong and what they're feeling?
Children are not like adults. Children does not have that much volume of vocabulary. They're not good in expressing themselves. Much as they want to, there is always this, not hesitation, but fear of not being understood, fear of, not saying the right thing. So parents, if this kind of anxiety really escalates, I mean to say like it's not like 2 weeks, a month, but it keeps on going and going every day for 5 months, 2 months, I think they should seek professional help. I would always recommend things like this, that the parents bring the child to a play therapist.
Right.
Yeah, because the playing is a child's way of talking. This is their way of expressing themselves freely, not being afraid, but in a safe domain. So play therapy, I would highly recommend it.
Okay, and which reminds me of an incident of someone who I know that their child was having very obvious separation anxiety from her father, and I think she was about 6 or a little older. And what happened was, because they were going through it every day, that the parents just took out the child from the school and I think homeschooled the child. So, I mean, is that a good option, or is that something to consider?
Actually, there are so many good homeschooling nowadays, okay? But if the child is 6 to 7 years old, I would really want to find out the reason why. Clear, sometimes there might be abuse in the family that the child cannot talk about, that the child don't understand, fully comprehend. Then, an adult should really look for it. Bringing the child out of school and putting the child in a homeschool, well, that's also good. There are so many good homeschooling programs nowadays, not like before. But again, if that's the reason why you pull out your child from a school and then i-homeschool yung bata, I think they need professional help first.
Okay, so what are the other red flags or signs that will make a parent say, okay, we need to seek professional help?
When the child continues to do this every day, to the point that it already hurt in everyday functioning niya. When the child cannot anymore cope with their everyday activities, routine, when the child is already manifesting nightmares, behavior that are not anymore normal, don't wait anymore, seek professional help.
Okay, now is it also possible that maybe there are some children that are hard to get, it's hard for the parents to get them to school, and maybe they're late sometimes. Is it possible that we could be misdiagnosing it as anxiety, or could they just be maybe lazy or didn't get enough sleep, or maybe a little tired?
Actually, that's nice, because sometimes we always as parents want to throw and say, my child just don't want to go to school, having anxiety, separation anxiety, when the truth is, of course, your child you don't want to go to school because last night he slept at 12 o'clock, 1 o'clock, watching TV, playing computer, playing the tablet, and then you have to wake them up early in the morning. Of course, lack of sleep is one of the number one reason. And then number two, they have to check maybe the child is really feeling sick. Maybe the child is overtired. Sometimes parents would say, oh, my child is going to school, I'm not going to let them sleep in the afternoon so that they can go and sleep early at night. That's not also okay, because the child will not be able to sleep when the child is overtired. So we really have to follow a routine, set boundaries for the children so that they will be ready, and prepare them so that they will be ready to go to school.
Okay, I have another question for you, but first we're going to go to a Twitter question. Will my child grow out of separation anxiety disorder, or should we seek treatment? So do they eventually grow out of it, or should they immediately seek treatment?
Parents, if it's still normal or not. If inside you, this thing keep on happening for months, seek professional help.
Okay, now going back to, I hope we answered that question. Now going back to what we were talking about before we go on break, we were talking about sleeping, and what is the recommended time that a child needs in order to attain that, so they're not so tired or under, they have to have enough hours of sleep. How many hours a day?
Normally for young children, at least 10 hours a day.
At least?
At least. Okay, 10 full hours of sleeping. I'm not saying that you let them sleep like 2 hours in the afternoon and then later tonight, 6 hours. No, 10 hours full of sleep. Straight. But sometimes some children, they can go for 8 hours, but actually for me, it should be 10 hours.
Okay. All right. Thank you. We're going to talk more about this. We'll talk more about other health issues of children in school when MedTalk returns.
Did you know that the term didascalenophobia is the fear of going to school? Around 2.4% of school-aged children suffer from it on a worldwide scale.
And we are back on MedTalk, still talking about health issues among children in school. And earlier in the break, we were just talking about this, Doctora, because my daughter, it's hard to get her up and go to school in some days particularly. But I know for a fact that she doesn't have anxiety or separation anxiety. So what are the possible reasons for that?
The most logical reason for that is maybe because your daughter wants to spend more time with mommy. Okay? Children really have this kind of, it's nothing negative. It's just that the child wants to have a little more time, negotiating time with mommy or daddy before they are finally dropped off to school. So that's very healthy. That means to say that you have healthy bonding relationship with your child. And then when the child goes to school, right, the child will enjoy so much school, and when they come home, mommy will ask, so how's your school? Oh, I had lots of fun. I had lots of friends. And then mommy will say, you didn't miss me. Oh, maybe sometimes it's the parents, but actually if
it's
children
the parents
are like
that have the
separation anxiety,
not the child.
Not the child. But if the child is like that, it's perfectly healthy. It's very okay.
Okay, and also, are there also, possibilities that maybe it's the parents that would make a child feel more anxious
Actually,
when it comes to school time?
Most of the time, it's the parents. That's why I said when the child has this issue, most of the time, we do not label the child as the one with the issue. We try to look, because the child, most of the time, are the victims. Sometimes some mothers would say, oh, you're going to go to school, you're big already, you're going to miss mommy. You're already injecting thoughts into your child when the child just needs, Doctora just mentioned, needs to have fun. School should be a second home to the child. Teachers should be their friends. So how come parents are the one that's injecting these negative thoughts, even if they said it in a positive and in a nice way, but the undertone there is very dangerous to the developmental mind of a child, because you're telling the child, oh, school is not fun, mommy's not there, it's not healthy at all. So it's the parents that inject this kind of negative thoughts, and the child, young as they are, pick it up without knowing if it's right or wrong. So when they are going to go to school and mommy or dad is going to drop them off, they started to cry, not knowing that they picked up what their parents put in their mind.
Yes, it's sort of you're conditioning your child already. So more of positive reinforcement.
Should be.
How do we encourage them or make them excited about school without any of those underlying or connotations? And just to be careful. How do we do that? Because parents are sometimes emotional and they can't control or edit themselves out.
Some schools right now, they do not, the first day they are kind enough. Right? They do not just tell the parents, oh, you cannot go into the school perimeter. So it's nice when you bring in your child to the class, first day, try to talk to the teacher. Have a nice chat in front of your child. This will send message to your child that, hopes, this is mommy or daddy's friend. I can talk to her too, like mommy and daddy. Right? And then before the school starts, if I were the parents and you have the time, go around the school vicinity. You don't have to actually go in the school, but oh, this is going to be your school. So that the child will be familiarized with the surroundings. See, this is a bigger place than our house. Wow, where's the door? Wow, you have a bigger door than our main door. Make it something exciting. Make it like a, not actually a fairy tale. Make it exciting for the child to want to look forward to. Oh, I want to meet your teacher. How about you? Tomorrow, make it exciting and fun so that the child will not be threatened, but will be eager to look forward to going to school because of the positive reinforcement that you have already, given in advance to your child.
Yes, and just a smooth transition, right? Now let's talk about common school problems. So now the child is in school. So how do we deal with what are, first of all, the most common school problems that some children encounter when they are at school?
Okay, sometimes parents are too quick to label, oh, my child is being bullied. Okay. Children, whether your child, my child, their child, anybody's child, likes to play around, like to tease and interact with one another. If children fight, let them solve it. Don't always solve the problem for your child unless this is already a big thing for your child, unless you see very negative reactions from your child. But sometimes simple arguments, you have to let your child solve it their way. This is one way to, equip them. Another problem is, being labeled as slow, being labeled as lazy, being labeled as not listening. Dr. Lourdes a while ago mentioned, not listening in the classroom because something is wrong with the ears.
Right.
Okay? For example, a teacher can report to the mother, PTC, your child is not listening to the classroom. I think your child is very restless in the classroom. And then the parent would say, oh my God, my son is, or my child has ADHD.
Yes, quick to diagnose or something.
Oh, as if they are already the
Doctor.
doctors, di ba?
Yes, that's true.
Parents, don't do that. It's very not healthy. ADHD does not only happen in school. It should be in two places, at home and in school. If your child is very naughty and restless in school, but very well behaved at home, that's not ADHD, okay? So a child can be, in school, not listening because something's wrong with the ears.
Right.
Not paying attention because something is wrong with the eyes. So parents check on it first before we think, oh, my child has an issue already in school. There's so many issues that we look first internally before we go out and say something or someone is bullying my child, or the teacher is not good to my child, or the subjects are too hard for my child, or the subjects can be not challenging to the child.
Right.
There are things that we should all take into consideration before finalizing saying, this is the reason. So
Right.
diagnosis is very important as well. Proper diagnosis.
That just reminds me of my daughter sits at the back of her class, and she was having a hard time copying from the blackboard because we found out later on that because she's very little and she's all the way at the back, so she has a hard time seeing. So they moved her to the front, and then she had an easier time seeing the blackboard, because all she saw from the back were, I guess, heads, because she was really tiny. So I guess there are other factors you need to consider, not just, don't be quick to diagnose them with some kind of disorder.
Especially with the Google now, the parents will be so quick, Google. That's very dangerous. Please don't do that. Because you're right. Children, your daughter may not know how to express, mommy, the reason I cannot copy is because I cannot see. All I see are backs. Because children don't think of it that way. Their cognitive station in their brain is not like us, right? So they just say, I just don't know why I cannot copy, but I am trying my best, mommy, I'm trying my best. But the thing is, we have to first find out. That's why it's very important for parents to go to PTC, not to just talk to the teacher, but to look at the environment of the classroom and find out, where do you sleep? Where do you sleep? Where do you sit? If you're seated at the back and you have something wrong with your eyes, better this is an issue that the parents should talk to the teacher.
Right. So also medical checkups are also
very
good.
important.
Like you said, the eyes, the ears, and everything. Now, what about how do we deal with factors like if there is such a thing as being bullied and or your child is skipping school, or even peer pressure? How can we deal with that as parents?
Okay, number one, parents, if you have a strong foundation in your home and you have a strong communication system with your children will open up to you. Don't shake them, don't force them, don't blackmail them into saying, I'm your mommy, I love you very much, you're supposed not to keep secrets from me. That's very dangerous. Hello, parents, don't do that. If your child is feeling something, and as parents, of course, our radar are always out, right? Be very careful before you go into their territories. Stay with them, journey with them. If you know your child is being bullied and your child told you so, do not say, oh, box him back. Then you're teaching your child to be a bully, right? Don't say, I'll go and talk to your teacher. Equip your child to speak up and speak out.
Okay.
And that's the best, because you do not only teach your child to fight back in a positive way, you teach your child and you empower your child.
To speak up and speak out. Okay, that's a very good tip. And now we have a Twitter question, Doctora. Can my 8-year-old already experience depression? What signs should I look out for?
Yes, 8 years old. But again, let us not be too quick to jump into saying, oh, my child, don't want to go to school, has no meaning in life. We have to first understand first. Maybe there are reasons why your child don't want to go to school. One of the factors maybe, the subjects are not challenging to your child. Or maybe your child, cannot cope with the subject in school. Find out first. Don't ask why. Try to find out how this problem came about.
Okay.
Journey with your child. Just stay with your child.
Okay, that's very, very important. And lastly, of any other final words for all the parents out there that are just concerned about their children, and of course now that it's time to let go because they're all back in school and there's all these worries. So what are just these little reminders that everyone or all the parents should remember?
Parents, just like you, once upon a time you were a child, you need to be nurtured. You need to be taken care of. You need to be held by the hands to walk. But remember, these are stages of development in a person's life. One day, whether you like it or not, that hand that you held, you have to slowly send them and let them fly. You cannot always be holding their hands. You have to remember, one day I will launch you into this world. And when I launch you, you will be able to flap your wings strongly and fly high.
Wow, thank you so much for that very amazing and enlightening reminder.
Welcome.
Thank you, Doctora.
Thank you.
And we would like to thank Dr. Lilian Nanggi for enlightening us about tonight's topic. And once again, thank you for joining us. Angel Jacob will be back next week here on MedTalk, your scheduled on-air consultation here on the Solar News Channel. Thanks for having me. Till next time, I'm Claire Sadran. Have a good evening. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. I'm Claire Saldran, filling in for Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on the Solar News Channel.
Your children spend more time in school than anywhere else aside from your house. By mingling with many other people, your children are exposed to bacteria and viruses that may lead to some back-to-school ailments.
Ang common diseases na nakukuha ngayon ng mga bata sa school, lalo't ngayong pasukan, ay itmang sumusunod. Halimbawa, yung ubod-sipon, may iba pang sakit, mga trangkaso natin yan. Tapos pwede rin magkaroon ng sore eyes.
Parents are encouraged to monitor their child's health by looking for signs and symptoms of any of these illnesses and how they progress over time.
Mainam din na maibigyan natin ng flu vaccines yung ating mga bata. Lalo sa panahon ngayon, papasok na ng matag-ulan, madaling makahawa yung mga trangkaso na yan. So mainam din halimbawa maibigay sa kanila yan.
Promoting healthy habits like eating a balanced diet and exercising regularly at a young age is recommended.
Kumain ng masusustansyang pagkain, yung isda, yung gulay, yung prutas, uminom doon ng maraming tubig. Tapos yung pagkain na mayaman din siyempre sa vitamin C. Kung wala naman yun, pwede tayong mag-take ng...
The season when the rain comes again.
And unfortunately, there's no vaccine yet.
No, not
dengue.
yet. Maybe next year, hopefully, because it hasn't been perfected yet. Not yet.
Okay, let's talk about the other diseases that's possible that the kids can contract. Urinary tract infection. What are the symptoms of that? Because sometimes a child will not really display any symptoms.
Fever again.
Okay.
Fever and even vomiting.
Okay.
They are very non-specific. Although occasionally some children can complain already of pain, but it's always fever. And how to prevent it is still like hygiene, personal hygiene. Because many children, as young as, well, of course, the kindergarten, maybe because they have to go to school, they still wear the diapers.
Right.
And of course, they should be toilet trained already
Okay.
by this time.
Okay, okay. Oh, and we have a Facebook question right now, Doctora. And the question is, what is an effective way to combat head lice? And that's very common also in the Philippines.
Again, it's personal hygiene, and somebody should not transmit the infection to you. Because if there is somebody who's infected, we have to treat the whole family, everybody, so that you can control the infection.
Okay, and is it easy for kids to get that amongst themselves
Very
in the
easy,
classroom?
very easy. The closeness, they get it easily.
Okay, and of course the symptoms would be if she's scratching her head more
Yes,
often than she has something there.
Right.
What would be a good, what would you suggest how to treat head lice?
Well, there's a shampoo. There's a shampoo that you have to use, which you will have to apply overnight, and then do the shampoo again the following day.
Okay.
And very surely they will be treated. But everybody in the family should be treated also.
Okay, because it can easily
Transmitted.
transfer to one person to another, especially at home.
Yes, yes.
Okay. What do you think are the other ailments that are uso, like in the back-to-school months?
Oh, well, sometimes they also have the school problems, like they just vomit for no reason. They come to you, they've been vomiting several times in the early, very, very common. But sometimes it can also be like allergic components.
Oh, okay.
Yeah, so they have to keep away from pollution, from so much dust. That's what really caused these infections also.
Okay. And another alarming symptom that we can find from some of our kids is diarrhea. And sometimes it could be caused by stomach flu or stomach bug or a virus. So what should parents watch out for when something like that happens and they start to vomit?
Well, actually, still number one is prevention. We should teach our children to hand wash all the time, most of the time just before they eat. And then they have to have clean water. Of course, the vaccines can also help, like the vaccination for children. As early as 1.5 months old, they have the rotavirus vaccine, because rotavirus is the #1 cause of diarrhea.
So they should keep a check on the list. There's a list of vaccines that they need to follow. What about right before school starts? Is there a particular vaccine that they should take?
Oh, they can have the flu vaccine. This will prevent the different strains of viruses.
Okay.
They can have it yearly. This is given once a year.
Once a year. So every year it's recommended that they get a vaccine.
Yes, because there are different strains for every year.
Okay, and not only for the flu, but also the measles and chicken pox.
Yes, chicken pox. Wow, it's a dreadful disease.
Right.
Because the children have to be absent in school so that the other children will not get transmitted with the infections. So it's good to have the vaccine as early as 1 year old and then repeat the doses.
Okay. Now, what about, let's say, for parents out there that, you know, we do know, because I'm a parent, and I know that when a child gets a fever, some parents get very alarmed. So when is the time that they should really take their child to the doctor, or when is the time that maybe they should wait it out?
Bawa ng supplement like yung mga vitamin C na syrup natin ngayon.
How can children cope with the rainy season? What can parents do to help their kids remain healthy? All these and more tonight on MedTalk.
Joining us tonight is Dr. Maria Lourdes Lagunilla, a fellow of the Philippine Pediatric Society, an international member of the American Academy of Pediatrics, and she is also the medical director of the Angeles University Foundation Medical Center. And you may join the discussion by calling our hotline at 548-4678. Good evening and welcome to MedTalk, Doctora.
Good evening, Claire. Good evening, Philippines.
Good evening. Do you know that everyone is back to school by now?
Oh, yes.
Kids are back, and you know, as we know, when kids are all at school, it's possible that they can get sick more often. So how do kids get sick more often now that it's back to school time?
We know that children have very low immune system, And then at the same time, it's the rainy season again.
Right.
So they easily get sick, especially when they mingle with other children again. Just very recently, I'm seeing already children sick on the first day of classes.
That fast?
Yes.
Well, it also started raining.
Yes. Sometimes it rains and sometimes it's very, very hot. And this
Yes.
contributes to the sickness.
Right, right. And so what do you think are the most common illnesses that we see amongst our children, especially now that it's school time?
Oh, they will have all sorts of respiratory infections. They will have diarrhea. And worse will be the more infectious diseases like measles. If you remember, 2 months ago, we just had the outbreak for measles. So we started again the vaccination for measles, the second doses. In private hospitals and clinics, we do them really routinely.
Okay, measles. What about the most common that kids always have? The common cold and cough.
Oh yeah, the common colds is actually the viral infection. Yes, it's also...
Because I think fever is a sign that it's your child is going through an infection.
Yes, that's true. When your child is actually looking very sick, not able to take fluids, not eating, then you have to consult already. Of course, you have the paracetamol, which we usually give, and even the water. But it's not enough. We have to check if there is a viral infection, especially dengue fever.
Right,
Yes.
right. Yeah. How do you know that if it could possibly be dengue?
Oh, the fever will persist. It persists more than 2 to 7 days. And the child will just be very sick also. But sometimes during the first stages, the child will just have fever, that's all. Then you have to go to the doctor to check. We do the tourniquet test, we do it repeatedly, and sometimes the blood count will help us.
And is dengue very common now that it's back to school time?
Yes, it will be, because it's the rainy season again. It's the breeding time of the mosquitoes. They're the carriers of the disease.
And how can the children prevent, or how can the parents help their children prevent getting dengue from school?
Wow, it's a community effort also. You have to have a very clean environment, free from mosquitoes, and even, of course, the school. It has to all be clean. If you can screen the rooms, it's better.
Right. Would you recommend the, kids' lotion or the patch that would
They should
scare
be good,
away
but
the mosquitoes?
there are no real studies that tells us that it's 100%. At least it will help. But preventing is really very, very important, like maybe wearing longer dresses or pants.
Right.
Yes.
Right. That would be a safe way. When is the time that it really peaks, the dengue season?
Well, about July and August until the months of October, we have a lot of cases.
Okay, so be very careful out there, especially these months, and make sure that you have some extra clothes for your kids, long sleeves. And
Yes, that's true.
Yes.
But you know that dengue is already all year round. It only peaks during